Hey, you're tuned in to Tech Talk with VLink, an award-winning podcast brought to you by VLink Inc. In each episode, host Tracy Gardner sits down and talks trending tech with global business and tech executives.
Welcome to Tech Talk with VLink, where we dive deep into how technology is transforming industries one bold leader at a time. Today's episode is especially exciting. We're exploring a real-world digital transformation story in rural healthcare. Our guest is Jeff Geaghan, CIO of a critical access hospital in Nebraska. Jeff brings more than 2 decades of experience across healthcare and AEC industries, and today we'll hear how his team brought a legacy tech environment into the modern age. Not a small task, and what that means for the underserved communities. Jeff, welcome.
Yeah, thank you for having me.
Jeff, let's start a little bit with some context. Describe the state of your hospital's technology landscape when you first took that CIO role.
Well, honestly, I kind of stepped into a situation where the fundamentals were already pretty solid, but we definitely weren't starting from scratch in that area. But what I walked into was more of an opportunity to move from stability to strategy. There was definitely a lot of legacy systems here. A lot of them just worked really solid, though. But it was just, I think, coming from my experience and my past, working for some larger organizations. I was able to kind of bring that in and change the landscape a little bit and get us, more poised for the future. So like that said, many rural hospitals, we still had a lot of room to modernize. And so one of the big shifts we made recently was moving to Nutanix, which has helped us. Currently, we're real new into it, but it's helped us simplify and scale our infrastructure. And while I rely on my network manager quite a bit, for the technical details of everything. But I can say from a leadership perspective, it has and will continue to improve our resilience and reducing our complexity and position us for future growth.
Awesome. What do you think the biggest pain points were or challenges that stood out early on to you?
There's quite a few. Again, coming from
Yeah,
a
I
larger
imagine.
organization, it was a lot different. But one of the biggest challenges was really adjusting to like the tighter budget constraints of a critical access hospital. I worked at a larger organization, like I said before, where we had a lot more dollars to work with. And then coming here was a different challenge altogether. We faced the same issues and demands as larger systems, obviously with cybersecurity, infrastructure upgrades, provider support, but we just have fewer resources and fewer dollars. Um, you kind of have to be more like surgical with your approach, making sure every single dollar has an impact. Another
That's a
challenge
good
was,
it's a good way to put it because that
yes,
that
yep.
is that is really a challenge with those budgets in the
It,
smaller
it,
organizations. Yeah.
it is, yeah. And when you have a lot more dollars to spend, I mean, even on a personal level, I think we all feel that when you have more dollars to spend, you can be a little bit more, lackadaisical with your spends on things and stuff. And in our situation, it's like we got to make sure every penny counts, and we got to make sure that we're not stepping over dollars to pick up pennies. And so,
Yeah.
one of those other challenges was just vendor leverage, and
Yeah.
when you're in a larger organization, it's easier to say, hey, I'm your customer and you're not meeting, our demands through A, B, and C. And they're like, we're very, very sorry. Well, and then the smaller organization, they're like, oh, okay, sorry about that. They don't really care quite as much, So
Right.
your voice doesn't really carry and have the same weight as it used to, from what I was used to. But I will say with that, and if I don't mind name dropping a partner that we work with, but
Sure.
we work heavily with CDW, and they have just been a great partner. They make us a high priority with everything that we do, and they've supported us like we're 10 times our size. So, but yeah,
Awesome.
that's probably one of the biggest pain points was just losing that leverage. But it's
Yeah.
it's been fine so far.
I imagine. Yeah, I imagine
Yeah.
so. And talking about the budget and the money, besides that, any other unique obstacles compared to what you'd seen in previous roles or industries?
Honestly, not necessarily. Again, the technology's there, but the other pieces that were a challenge was just when you have a community that's tight knit like this.
Yeah.
It's a little bit different of an ordeal. Whereas like before, it's like when you're dealing with a community that, or not necessarily a community, but an organization where you have your employees that are spread out across the United States. I guess it's got pros and cons to it, but the pros to a larger organization is that there's just a lot more experience and a lot more different um, um, what would you say? Just complexity, I guess, on the IT side
Yeah,
of things that can actually be more fun, I guess. But it adds a lot of layers of issues that we run into. But
sure.
the challenge coming in here is, which again could be a pro, is that every single person that you're working with, you're probably going to see them in the cafeteria, or you're going to be sitting next to them at the baseball game or something like that. So I wouldn't necessarily say that's a challenge, I guess, dealing with that, but it just was something that was different getting used
Different.
to.
Yeah, for
Yep.
sure. Yeah,
Yep.
a big fish in a small bowl instead of a big fish,
Correct.
So,
Yes, absolutely.
yeah,
Yep.
for sure. As CIO, Jeff, how do you go about building a vision for tech transformation? What do you think? What were your first steps that you took?
Yeah, so that's a good question. So, honestly, the first step that I took was just listening. Again, I've been blessed with working in two different fields with the AEC industry, heavily architectural and engineering background, coming into IT and then doing IT within that industry, but then also in healthcare as well. Um, it definitely both sides you still have cybersecurity problems, you still have all those different things and everything, but coming in with those different experiences, it's kind of nice because you're not, like you said about the fishbowl kind of a thing. It gives you a little bit more of a different perspective to look and
Mhm.
see of when you're. I always give the analogy. I'm sorry, I'm going to break off a little bit here, but I love giving analogies, but I
No,
give the
that's fine.
analogy.
Give
I've
it.
been a musician for quite a few years of my life and everything. And so sometimes when you're writing music, you can spend, 2, 3 weeks on this song. And you think, man, this is just the best song I've ever written. And then you play it for somebody and they go, that's interesting. I probably wouldn't have done A, B, or C or something like that. And you're like, what are you talking about? But just having that outside perspective, they say, this bridge is wrong here, or, whatever. And it's like, I never thought about that, and so that's why having that outside perspective, I think, is so important, and it's just
Yes.
having new, fresh eyes on things is very important. So, but like I said, so like the first step was just really listening. I sat down and talked with all our providers and our department leads and nurses and our admin staff, and I just really tried to understand what was working and where they were struggling, and all of that feedback, it just really shaped our roadmap.
Yeah.
And our roadmap is plentiful. I think people would probably think, in a small rural setting and stuff, we only got a couple pennies to make a couple things work here, and we're using duct tape and baling wire or something like that, but we have a
Exactly.
very advanced system
That's good.
with what we got working on here. And but like I said, I came into a pretty good setup. But moving forward, right now we've just been really focused on our foundational upgrades, like the Nutanix shift for our infrastructure,
Yeah.
and then we also moved to a cloud-based communications platform with Zoom. Which was a huge, huge shift. We went from a
Yeah.
SIP phone system to all cloud-based, and that was a very, very heavy lift. And then the other thing was strengthening our cybersecurity. I mean, that was something that I did almost day one. It was within a couple months. It's a lot to take in when you're used to this organization for 7, 8
Yes.
years, and then you come in here and it's like, okay, start telling me. You have to ask all the right questions and see all the right things, and then a few months in, I was like, oh, okay, well, we're doing okay cybersecurity wise, but I think we could do a lot better. And so that's what I jumped on right away to make sure I could get some good sleep at night. So,
Yeah, for
but
sure.
yeah, so we went from a very, I would say, ad hoc approach when I first got here with our cybersecurity. We had a lot of neat pieces in place, and but I was like, I really think that having a nice partner to work with, such as Arctic Wolf, which is who we went with, to basically give us that 24/7 support, it made a
Yeah,
huge difference in what we were doing. So I think we have
absolutely.
all the nice pieces in place. We use them. We use um, know before, for fishing, and Sophos, and we just have all these good pieces in place. And we're probably going to get hacked now that I'm bringing all this up.
Yeah, don't tell all
I
your
need to knock
secrets,
on
Jeff,
wood,
because
but we've been doing very well.
exactly. Well,
Exactly. But
security is so important with the healthcare system, just because of all the patient files and all of the sensitive information. So I'm glad to hear that, you definitely made that a priority in your initiatives. How do you think, Jeff, you align technology initiatives with your organization's strategic goals? Was it difficult or pretty easy?
so good question. I'd say every initiative really ties directly to like the broader goals, like patient care, provider satisfaction, operational efficiency, and safety. So, for example, like rolling out recently, what Cerner or Oracle Cerner, they
Hmm.
are electronic medical records software that we use. So they rolled out what's called Clinical AI Assistant, or CAA for short. And it's a really neat piece of software within their software that, as the provider goes into the patient room, it listens to the conversation. And typically, the provider would sit down and they'd ask questions and they type in this and
Right.
type in that, and there really was a barrier between the provider and the patient and
A
that
disconnect.
communication, very
Hmm.
cold. And so now they can actually look at them, pupil to pupil, and have a good conversation. And so the AI listens to that and it creates the notes as a summary and puts it inside of that patient chart. And
Oh, that's
it just
cool.
creates a way better platform. So
Yeah.
that was definitely something about reducing provider burnout and improving documentation efficiency. It was a huge goal of ours. So, but yeah,
Yeah, well, it's always interesting to hear, what people are doing in healthcare. I mean, and definitely how you've transformed. You've mentored other IT leaders. You mentioned. What advice would you give to someone trying to drive tech transformation in a similar size company? Not necessarily healthcare, but maybe.
good. So what I would probably start with is people, not the products. I think in the IT world, we go to school for this stuff. They don't really teach you about the people side of everything. It's all about, we're tech
True.
nerds. We read the magazines. We like to get on the internet and check out all the fun, bells and whistles of everything. But I would just always tell people, and what I have been always telling people, is just start with people and not the products. Build
Yeah,
trust with your team, understand your organization's pain points, and don't try to solve everything at once. Small, meaningful wins help you build momentum. They build trust, and it's just that's probably the most impact that you're going to make. And
yes,
also, talk in business terms, like with people, and explain how the IT projects are connecting with real outcomes like revenue protection, patient safety, staff satisfaction, things of that nature. So,
absolutely.
but yeah, and you just got to gain that executive and cross departmental buy-in.
Trust and communication. You're so right.
Yep.
So I thought it would be fun to kind of do some rapid fire questions. Say what comes to your mind first. One piece of tech you can't live without at work?
Unfortunately, my phone, it's my communication hub.
Yeah, yeah,
Yep.
yeah. Oh, yeah. Okay. Biggest myth about rural IT, healthcare IT.
That we're behind. In
Okay.
reality, our size lets us innovate faster and adopt quicker than larger systems.
Like that. I like that a lot.
Yep.
A book, podcast, or leader that inspires your approach to innovation.
I'd say Leaders Eat Last is a book by Simon Sinek. It
Oh,
really
yeah.
aligns
Simon Sinek.
perfectly with my approach to servant leadership.
Love it. Favorite part of being a CIO?
And the whole reason I got into IT, helping people,
Yeah.
whether it's a nurse, a patient, or someone on my own team, I just really love seeing technology remove barriers and restore time for people. It's just
That's
nice. It's a
awesome.
good feeling.
That's awesome. Well, Jeff, it's been great. Do you have any last thoughts before we wrap it up?
Um, I don't think so. I think I just wanted to thank you for the opportunity. I think
Sure.
it's good to have a voice, in a rural setting such as this. And I love your show. I love your platform, and
Thank
I've
you.
learned a lot from the guests that you've had on, and it's just a blessing to be a part of this. So I
Well,
appreciate it.
we certainly appreciate you being on because we've learned a lot from you too, and we've learned that you can do a lot with a little. I think, and that's important if you do it the right way, and I think you've shown that. So, I love to talk tech, and thank you so much for joining us, Jeff. We certainly appreciate it.
Thanks for listening to this episode of Tech Talk with VLink by VLink Inc., headquartered in Connecticut. We'll see you in the next one.